Hi, Rikhil. Okay, maybe you can unmute yourself now.
Hi, ma'am. Good morning.
Hi, Rikhil. Are you
Hi,
able
ma'am.
to
Good morning.
unmute
Very good
yourself?
morning. Uh, yeah, the doctor would be joining in the other 5 minutes.
The policy number in this one, actually, the first one actually, because that policy number is right?
Yeah, perfect. I can see it. Um, if you could please request doctor to join quickly because we only have 5 minutes now and we'll have to start sharp at 10.
Sure, ma'am. I'll
Also,
ask the doctor.
Rikhil,
Yeah.
the
Yes, ma'am.
doctor will be introducing himself, right?
Exactly. Yeah. The doctor will be introducing himself. Yeah. Hello.
Are you able to unmute yourself, Rikhil?
I've already unmuted, ma'am. I'll try to rejoin. One second.
Rikhil, can we have the
Yeah,
doctor join,
ma'am, you are
please?
able to hear me?
At least unmute yourself.
I've
How do I communicate
already,
with you?
I've already unmuted, ma'am.
Can you say something, Rikhil? I believe.
Yeah, ma'am, are you able to hear
Yeah.
me? Yeah,
Yes. Now I
yeah,
can hear you.
yeah. Because I did unmute myself. I'm just waiting for the doctor. He's here. Uh, and we'll just start the session in 1 minute, ma'am.
Rikhil, can we please have the doctor join? We have now members waiting in the lobby.
Ma'am, the doctor will be joining, ma'am, right away. Just waiting for him.
Is he around?
Yes, 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 ma'am. He's there.
I don't want the doctor to join while, members are in the call. And I have to let the members in. I don't know
Yeah,
what's
yeah.
going on.
1 second, ma'am. I'm just waiting for him. He's there. He's there in the in his OP. I'm just waiting for him to come in.
Okay. I have to let people in.
Yeah.
It's 10:01. Okay.
Doctor,
I'm not
yes.
happy with this, Rikhil. This is, 100 times we say if we
Doctor,
are
could you
starting at
please
10
come in,
means we
doctor?
have to start at 10.
Doctor, the people are waiting, doctor. Please, please, doctor. I'm just 2 minutes, ma'am. He's coming in. He actually got a last minute emergency call for that sake.
I am admitting people. Could you please
Yeah.
request him to
Yeah, yeah,
introduce
he's
himself? What he
okay. Sure.
and
Sure,
put
sure.
on the camera, please.
Yeah, sure, sure.
I'm letting members in. Okay, so we can't
Okay.
no more have this discussion.
Okay, okay. Just
Please
a
put
second,
on the
ma'am.
camera and let him introduce himself.
Ma'am, yeah, he's not in the room. He's just coming in a minute. session. I'm just turning it on. I'm come sit. So, can I just hello.
Hi, doctor.
Yeah, hi, hello everyone. How are you? Good morning.
Good morning.
Uh,
Are we good to start, doctor?
yeah. I'm Dr. Muhammad Abu Bakr Al Sakaf. I'm a general practitioner working in the urgent care department in the NMC Royal in BZ. So, our topic today is we will talk about the heat and hydration health. And in this topic, I will divide it into three parts. First part, we will talk about the dehydration, the relation between the dehydration and the kidney stone. The second part, we will talk about the dehydration and the kidney health. And the third part, we will talk about the dehydration and urinary tract infection. And you will see that in this topic, we will focus between the relation between the dehydration and the kidney health in general, because it's the first organ the dehydration can affect in our body, the first system. So let us start now. Yeah. So in our topic, we can see we will talk about the why summer heat can increase the kidney risk, and also we will talk about the employee focusing prevention and awareness. So let us start. We will start the first topic. As I told you, the first topic will be the relation between the dehydration and the kidney stone. So the first question is why kidney stone in summer become more common? And we can see that in our department during summer, we facing a lot of patients. They come with kidney stone. So you can see the first reason is the heat can affect the urinary system more than we are thinking. So the hot weather, how can do that? The hot weather will increase the sweating and the urination. What this will lead into fluid loss in our body. So at the end will lead into dehydration. And the dehydration itself will lead into make the urine more concentration. So what that mean? That mean the urine will promote more crystals. So at the end will lead into stone formation. And by the way, one information also, you can see that when the person has dehydration, how can he know? He can know by simple thing, for example, from the urine color. We will see in later in other session. So also the higher incidence during summer month increase the kidney stone, as I told you before. Okay. Now we know that the kidney stone formation itself increases during summer. So how can we prevent the kidney stone, especially during summer? First of all, we need to drink minimum between 2.5 into 3 liters of water daily, especially during summer. Second thing, we need to reduce the excess salt and animal protein, especially in our food. Second thing, we need to avoid the dehydration as much as possible, especially during working, especially if this kind of job is outside under the sun. Okay, now we will know about the kidney stone signs and symptoms. How can someone know that he has a kidney stone? We will know that now. First of all, he will have like flank pain, severe flank pain, sudden severe flank pain, either right or left or bilateral. Also, he will have blood in urine. He can see that in during urination. Also, he will feel like burning sensation during urination. And he will have nausea and vomiting because of the pain, not because of the stone itself. No, the stone itself will not make nausea and vomiting, no, but will make pain. The pain itself will make the nausea and vomiting. And we can see the severity of the pain from the nausea and vomiting, especially if the patient continuously vomiting. So now, خلاص, we know in those topic before about the relation between the dehydration and kidney stone. And now we will move to the other part. We will talk about the relation between dehydration and kidney health itself. So the dehydration itself can reduce the kidney filtration efficacy, especially during long time or repeating the dehydration. At the end, the filtration efficacy itself of the kidney will be decreased. Even if later you make like rehydration will not become as before, only after long time from rehydration. Also, the dehydration itself will increase the risk of acute kidney injury. So this acute kidney injury, if you did not avoid it, it will be permanent, especially later will lead into kidney failure, renal failure. Also can lead into chronic kidney disease, which is, as I told you before, will lead into kidney failure, renal failure. So now we will talk about the signs of dehydration. As I told you before, one of them is the urine color. Now we will know what are the signs of dehydration. How can someone know that he has dehydration? We will see these signs now, symptoms and signs. So first of all is the urine. As I told you before, if someone can see his urine is too much dark, that means he has dehydration. And always it's like grades, like levels of dehydration in the urine itself. When the concentration of the color of the urine increase, that means the dehydration increase. When the color of the urine reach into dark, no, that means this patient has severe dehydration. Second thing is the headache and dizziness. The patient, he will have like dizziness and headache because of the dehydration itself. And the reason for that is the blood itself. Because why? During dehydration, the blood will be more thick. It will not be that liquid. No, it will be more thick. So it will be difficult for the body to deliver the blood into the brain. So the patient, he will have dizziness and headache also because of that, because of the dehydration. Third thing is the fatigue. Same thing as I told you before. The blood will be heavy, so will be thick and heavy. So it will be difficult for the body to deliver this blood into other parts from the body, other organs. So in general, the organs will have less energy because of the blood, delivering the blood. Then the dry mouth, same thing. The person, he will have always dry mouth. Even if, for example, he drink water, he will have dry mouth. Some of them, they will think that they have diabetic, but no, he will have dehydration. Okay, and reduce urination. Same thing. When there is no water in our body, so what will happen? The kidney filtration will be decreased. What will happen will lead into decreased urination. So the person who has dehydration, rarely he will go to the washroom for urination. Even I saw some of them, they went only for the washroom once daily because of the dehydration for urination. Okay, now we will see the third part. We will talk about the relation between the dehydration and the UTI, the hot weather and the UTI. We will know now what's the relation between the hot weather, which is can lead into dehydration and can lead also into urinary tract infection. Okay, now you will see dehydration will reduce the urinary flushing. So will decrease also the urination, will lead into decreased urination. So what will happen? Will happen the urine content, which is has a lot of bacteria, will stay inside our body, especially will stay inside our urinary infection for a long time. At the end, what? At the end will lead into increase the bacterial growth in our urinary system. So also the heat will lead into dehydration. Also, the heat can lead into poor hygiene because of the sweating a lot during the heating and heating weather. So now we will know the UTI, the urinary tract infection, signs and symptoms. And by the way, it's same like the kidney stone, except in one thing, in one signs and symptoms I will tell you. First of all, the burning sensation in urination, same as the kidney stone. Second thing is the frequent urination, same as kidney stone. Third thing, the urgency, same as kidney stone. But here, the fever. The kidney stone will not make fever, but the urinary tract infection, yes, will make fever. But one thing, maybe the patient has kidney stone, but the kidney stone make infection also. So he will have both. Many patients come to me, they will tell me that since long time they have like dysuria, like burning sensation during urination, or some of them they will say I have like abdominal pain, but not always. But then suddenly they will have fever. So what that mean? That means they have, most likely most of them, they have already kidney stone, and the kidney stone make infection in the urinary system. Lower abdominal pain, same thing as I told you. When the patient has abdominal pain, maybe because of the kidney stone, or maybe because of the infection, or maybe both together. Okay, now when we have to see a urologist, especially if we have any symptoms, as I mentioned it before, either because of the dehydration or kidney stone or the kidney infection. For example, if, as I told you, if the person has these urinary symptoms, for example, abdominal pain, burning sensation, urgency, blood in urination, whatever, as I mentioned it before, no. If he has these symptoms, especially for long time, no. Better to see urologist as soon as possible to rule out or to know what exactly he has. Why? Because, for example, as I told you, the dehydration itself can make dysuria or burning sensation or whatever, the dehydration, but will not make pain for sure. So many patients came to me, they have any one of these symptoms except fever and abdominal pain. Then when I check for them, especially when I do blood test and urine test and ultrasound, I check that everything normal, but they have severe dehydration. Because of the dehydration, they had like symptoms look like kidney stone or infection, urinary infection. So, for example, in case of severe pain, if the person has severe pain, especially abdominal pain, either flank pain or lower abdominal pain, or in general, any kind of pain in the abdomen, severe, no, he must see the urologist as soon as possible. Fever, as I told you, if the person has any one of these symptoms with fever, no, that means it's infection. But the most important thing regarding the fever, if the patient or if the person has flank pain, severe flank pain with fever, no, he must come to the urologist to rule out pyelonephritis, to rule out the infection in the kidney itself, because it's danger. If there is infection in the kidney, this patient must be admitted and take strong antibiotic, or the infection itself in the kidney will lead into kidney injury. Same thing as I told you before, if this patient has visible blood in the urine, he must see urologist as soon as possible. Also, in case of difficulty passing urine, same thing. He must see urologist to check for what's the reason for this difficulty, especially for old persons. They have to see to rule out any kind of prostatic hyperplasia or prostatic cancer. He must check the urologist to rule out these. Okay, now regarding the workplace prevention, which is very important because our topic will lead into this. Because most of the patients who's coming to us, most of them, they are, how can I say, they are not caring about their health, especially about the rehydration because of their job. Not because of they don't want, no, because of their job. So the most important thing is the hydration regularly. What I mean, for example, you are working. Okay, your work is very important, but your health is more important. In case if you can hydrate yourself, as I mentioned it before, do it. Especially you have to drink, as I told you before, minimum 2.5 into 3 liter daily. Same thing, try to take cooling breaks during your job to take rest and also for the rehydration, especially if your job is under the sun. Also, use shades, air conditioned areas. As I told you, if especially your job is under the sun, you have to do that, especially during summer. At the end, you have to seek medical advice early if you had any symptoms from I mentioned it before, to check what's the reason for these symptoms and signs and to be treated. Okay, now what are the diets during summer we need to focus? Why, first of all, this question, why diet matter during summer? You can see the high temperatures will increase the fluid and electrolyte loss through sweating, so will lead into dehydration. The body requires higher nutrition rich food for better digestion and energy. In proper nutrition helps prevent dehydration, fatigue, and heat-related illness. Okay, what are the recommended food? We will see more in other slide. We need to focus during summer for rehydration, especially for the fresh fruits and vegetables, for all grains, for lean proteins like fish, chicken, legumes, low-fat dairy product. What are the benefits? The benefits is, for example, the energy we will maintain during especially our work time, the energy level, we will support our immunity system, immunity function, and we will help to regulate our body temperature, especially during summer. Now, what are the foods, especially we need to focus during summer for rehydration, I mean? You can see by percentage. The number one is the cucumber. The percentage is 96% from the water content. The lettuce, 95%. The watermelon, 92. The strawberry, 91. The orange, 87. And the tomato, 95. Additional health of food, for example, the yogurt and lemon, the coconut water, the vegetables soup, and the fresh fruit salads. At the end, that's the conclusion. We need to aim to obtain 20% to 30% of our daily food intake from one of these foods. So what I mean, daily you have to focus on of one of these or all of them during daily food, especially during working time. So for foods and drinks to limit during summer, these foods we need to avoid, especially during summer, because these foods will lead, how can I say, in general, will lead into decrease rehydration, so will lead into increased dehydration. For example, the fried and oily foods, the heavy, high-fat meals, the excessively spicy food, the processed and salty snacks. Same things also regarding the drinks to decrease it. For example, sugary soft drink, the energy drinks, the excessive coffee and tea, and finally alcohol. Alcohol always, not just even during summer. Why? Because these food and drinks can increase the dehydration, as I mentioned it before. Also, will make like the digestive become difficult, also can contribute to lead to fatigue and reduce performance of our body. Okay, these healthy alternative water refuse infused and fruits, fresh juice without adding sugar or minimum sugar, lemon and buttermilk, coconut water. Okay, and finally, I finish it. Anyone has any question?
Thank you, Doctor. Yes, we will open the floor to Q&A, and if you have any questions, please feel free to put in your questions in the chat box.
Any question?
We'll wait for the questions, Doctor. Let's wait for
Okay.
attendees to put in their questions in the chat
Okay.
box.
Okay. Okay. I hope everyone understand what I said regarding this session because it's very important. Because I'm talking about myself. I'm too much facing patients coming to the urgent care for having one of these complaints I told you before.
Doctor, while we are still waiting for questions, I would like to understand how is it, how useful are electrolytes, and should everyone be consuming electrolytes on a daily basis? If not, what is the requirement? In what case should one be consuming the electrolytes, and are they actually healthy?
Yeah. Regarding this question, I will tell you. I will give you an example. Okay. For example, if you put a cup of water under the sun, okay, so the sun, the heat itself will consume the water. So what will stay? Will stay the salt, especially electrolyte. But what kind of electrolyte? Because the idea of the electrolyte is very important in our body. For example, potassium, for example, magnesium, for example, sodium, and others. The idea of electrolyte, it's very important for our neurology system and muscle and everything in our body. The electrolyte is very important. So decreasing one of these electrolyte for sure will make problem in our body. For example, uh, as I told you in this topic also, first of all, it will affect in our urinary system, especially our kidney health will affect. It will affect our neurology system, especially during uh, the what you call regarding the delivery of the electric to our body from the neurology system. It will affect also in the heartbeats also. It will affect the electrolyte. It will affect in all kind of our body, the electrolyte. And as I mentioned it before, the very important electrolytes, all of them are important, but the most important one is the potassium, the magnesium, and the sodium. Especially these three, and the bicarbonate also, but especially these three are very important to our body, to our organs, and our systems in our body. And in case of dehydration, the dehydration itself, it will decrease the balance of these electrolytes. Some of them will be decreased and some of them will be increased.
Thank you, doctor. We do see one person asking about the Pocari sweat drink. I believe it'll be the same as electrolytes, right? The
Yeah,
same
yeah, yeah.
concept.
Yeah,
Yeah.
yeah, yeah, same, same.
The next person is asking, what vitamin supplements do you recommend in the heat while working under the sun?
Ah, okay. Okay, good question. For the vitamins, we will try to focus for any vitamins can help in absorption in the water in our body. For example, same these vitamins. For example, is the vitamin, for example, a vitamin C, which is very important in absorption of the electrolyte and the iron also, the vitamin C. For example, is the vitamin A. Vitamin A, for example, is very important for our eyes because many people who has deficiency in vitamin A, they will have dryness in their eyes because of that. The other thing, for example, vitamins and our bones also. Uh, what else? What else of vitamins? What else? Vitamins. Also, the zinc is very important in absorption. Also, it's very important in our immunity system. And these vitamins I mentioned it before, also they are very important in our immunity system. That's why you can see during summer the percentage of sick patients increase even in winter, but in summer how? In winter the viruses will be increased, will be active, but in summer no, because of decreasing the electrolyte and vitamins and because of the dehydration.
Thank you, doctor. Another question that I would like to ask is, what should be the first aid for a person who might be going through a heat stroke? What is the immediate um, action that people around that person should be taking?
Yeah, for that person, first of all, they have to remove the person from under the sun or from the place that the heat is there and put him in cooling area. This is number one. Number two, try to give him as soon as possible water with sugar. Water with sugar. Better even that giving the patient juice because most of the patients they will have dehydration with hypoglycemia. So water with juice is very fast regarding the absorption in our body, even more than the juice itself. Second thing, third thing, try to take the person into the nearest hospital, especially nearest emergency, to get medical treatment there as soon as possible.
Thanks a lot for answering that, doctor. We'll wait for a few more minutes and see if anyone has any questions. All right, doctor, I don't see any more questions coming in. So, with that, we will wrap up the session. Thank you so much, doctor, for your time and sharing all the tips that definitely made us think how important hydration is. And I would also like to say, of course, hydration is extremely important for people who are working outdoors and in the sun, in the heat. But it's equally important for people who are sitting indoors because we are constantly under air conditioned environment, and because we are in that environment, we forget to consume water, right? So
Yeah, sure.
that tends to create more dehydration in the body. So
Yeah.
that's a reminder for all of us who are actually sitting in the AC behind our screens and forgetting to sip on that water.
Okay, thank
All
you.
right. Thank you
Thank
so
you.
much, Doctor. Thanks to
Thank you.
everyone
Thank you.
who joined in.
Thank you.